Hi, everyone. This is Heather Augustyniak, lead survivorship nurse practitioner for Baptist MD Anderson Cancer Center. Today, during our Life After Cancer patient education series, we're delighted to have Patrick Regis, who is a nurse practitioner with our Neuro-Logic Oncology program here at Baptist MD Anderson Cancer Center. Today, he's going to be talking about an important topic for many cancer survivors, and that's peripheral neuropathy during and after cancer treatment. Patrick, thank you for being here, and I'm going to let you kind of summarize what we're talking about today and open it up for questions.
Okay, awesome. Thanks, Heather. So as Heather said, I'm a nurse practitioner. I work with Dr. Robert Cavalieri here at MD Anderson. We see neurologic patients, usually with brain tumors and spine tumors, but a lot of it does include side effects from having cancer, side effects from treatment, which a lot of the time it does include neuropathy. So peripheral neuropathy that comes from chemotherapy, it's the fancy name for it is chemotherapy-induced peripheral neurotoxicity. We just call it neuropathy. It refers to a dysfunction of the neurological system that's outside the brain and spine. So it isn't something necessarily wrong with your brain or your spine, but it's wrong with the nerves that are in your arms, your legs, your toes, your hands. People with cancer have an increased risk of having neuropathy, whether it's from the tumor directly affecting it or chemotherapy or radiation sometimes can do it. There's been multitude of studies that they vary widely, but a lot of cancer patients typically deal with neuropathy at some point, whether it's very mild or quite severe. There's been a study that actually found that 47% of women of multiple cancer types suffer from peripheral neuropathy over the course of 6 years they looked at. And that's a lot of it is because typically, women are the majority of people who unfortunately get diagnosed with breast cancer. And a lot of the drugs that go into treating breast cancer can cause neuropathy. So that's probably why. Oh man, sorry. Men who also receive different types of chemotherapies have had neuropathy as well. In one study, it found that 39% reported issues with the hands and feet. Another one just reported paresthesias. Um, some common causes outside of cancer is typically diabetes is the most common one that you'll find. It's not unheard of that people with diabetes and cancer are at a higher risk of it, especially if their diabetes isn't as well controlled. So whenever you're diagnosed with neuropathy, we will usually look and see if you have a history of diabetes. Other times you can find it if you have vasculature problems. So if you have poor blood flow to your legs, that might cause it as well. That might raise your risk. And vitamin deficiencies such as B12, which is much less common, but still an occurrence.
So, for the patients that receive cancer treatment, um, what kind of symptoms can they expect if they have neuropathy?
So the usual symptoms people will experience is more of a numbness or a tingling. It's not common that it's pain, although it certainly can be, but you might find that in your fingers, the tips of your fingers or the tips of your toes or the bottom of your feet, and these areas that are more on the surface can start to feel numb or tingling. The important thing to know is it usually doesn't develop immediately, but over time, after 2, 3 doses of whichever medicine you're on that can cause it, you might notice that the neuropathy picks up. So, for instance, when people are getting treated for breast cancer, they might have their neuropathy begin in their toes and their fingertips. And it might be very mild, might last for a day or two after infusion in the beginning. However, after the third, fourth, fifth dose, it usually does start to pick up. But most of the time, it's numbness and tingling. Every once in a while, though, it can be painful. The tingling can be really irritating. It can be annoying. And sometimes it can almost feel like when your hand falls asleep, if you've sat on it, or your leg falls asleep, if you've had your legs crossed. So that's another common feeling you might see.
Now, for those patients that have cancer treatments that may provoke neuropathy, because not all of them do, is there anything they can do to try to prevent? I know that a lot of patients ask about icing or cryotherapy and so
Mhm.
forth.
Yeah, they've looked at a lot of different treatments, and I looked myself to see if there's been anything new, and unfortunately, there's not been a lot of information that was really useful. The things that they've looked at medicines to help treat it, which usually is good for pain, such as gabapentin, or neurontin, Cymbalta. They've looked at to help treat the pain, but to help prevent it from occurring at all, there hasn't been a lot. They've looked at exercise, which may have a preventative benefit. So sometimes making sure that you're staying active may have some importance to it, and that's usually probably from increasing blood flow to the area. Other things they've looked at is different creams they haven't found much evidence of. They've looked at B vitamins, vitamin D, steroids, vitamin E. None of them really have had any benefit to it. So, when people ask, how do I prevent it? Usually it's you stay active and you try to make sure that you're not sedentary while you're receiving chemotherapy, which can be hard because it can definitely make you tired too.
Absolutely. And I always let my patients know to report it as soon as they can because sometimes even dose reductions in the treatment may be warranted.
Hmm.
Um, with neuropathy, is it always permanent or can it go away?
Yeah, that's a good question. We get asked that a lot. Usually after a few months of being off of the treatment, it can start to improve. However, we've seen it last for 2, 3 years sometimes, and sometimes it even goes longer than that. It's not uncommon when you've received a platinum-based chemotherapy for it to go up to 2 to 3 years if you have neuropathy. Usually, though, if it's bad, it does get better, but it doesn't go away 100% during that time. So if your neuropathy is severe, if it's at a higher level, it does improve once you're off of the therapy, but it doesn't go away for a long time. Thankfully, though, it generally speaking, it usually does improve to where it's tolerable, but the therapy usually stops at that point.
And can neuropathy affect other areas of the body, not just our fingertips and toes?
Neuropathy, the reason why they call it neurotoxicity is not because it's totally toxic and it's an awful drug, but because it just causes side effects. So, neuropathy is mostly in the hands and the feet, but a lot of times neuropathy can also happen in your face and in your ears. Neuropathy, meaning your hearing, can have issues. So for some drugs, you might find that you need hearing tests during and while you're on treatment. Usually that's in the younger population. But typically, when we talk about neuropathy, it's peripheral neuropathy. So when you think peripheral, you think your hands, your arms, your toes, your legs.
And when do we initiate treatment for neuropathy? I've heard, only when it's painful or, you know, we've heard various things. When would it be recommended?
Yeah, so treatment usually starts when you find that it's an annoyance. If the goal is to keep going with the medicine, you're tolerating it well, other than this neuropathy, and it's felt between you and your oncologist that I want to keep going with this medicine. It's tolerable, but I need to try something to treat the neuropathy. That's when we'll typically start something. You'll find differences in how people wish to start. A lot of times it's gabapentin, other times it's Cymbalta. It's typically not opioids that they use up front. That hasn't shown to be very effective in treating it. Sometimes it just helps to dull the pain if it's quite severe. Um, We'll also tell people, take a B complex vitamin because sometimes that can help. They've looked at acupuncture sometimes that helps with it too. Even cryotherapy. So, it may not help to prevent it, although it might. It definitely helps to treat it. So we'll usually start treating it if it's painful, if it's a problem. But if it's more or less an annoyance, it's just something you notice and it's not getting in the way. Typically, there's no medicine that needs to be started.
Are there any supplements that can help?
Yeah, so the B vitamins sometimes can help. I'm not sure of the effectiveness of it. There's not a lot of data to support it, but it doesn't hurt. Vitamin D has been looked at as well, and vitamin E, which may have some effect as well. Again, the effectiveness of it isn't quite high. They've looked at calcium and magnesium, which also has some component to helping, but again, it's not great. We'll tell people sometimes it's just whatever works. If you find something, as long as it's not hurting you and it helps you, you find that it helps your pain or it helps the symptom and it doesn't hurt you, we'll support it 100%.
And for the patients with neuropathy, do they need to be any more cautious about certain things, safety precautions specifically, I would think?
Yeah, I was actually glad you brought that up. That was something I meant to mention. Neuropathy often can mean that especially if it's in the soles of your feet, the bottom of your feet, it can be a problem. And that's not just because of pain, but even if it's numb, it can mean that your walking is off. So sometimes you'll find that when you can't feel the bottom of your foot or you can't feel it well, you might feel like you're not able to walk as well as you once did, and you can have gait issues or problems with your walking. Um, a lot of people say, I just don't know where my foot's going when they put it down. And that's something called proprioception. And that's typically where you don't know where your leg is, even though you look at it, you can see it, you don't know if you're not looking at it. So sometimes we'll actually refer people to physical therapy to work on that. And again, with exercise, with training, typically that's something that improves. Other things that we recommend is not having an open-soled shoe or open-toed shoe. Having something like a normal shoe, not a sandal, not a flip-flop, but a shoe, an actual sneaker is what you need to wear. Because when you have your toes out, you might stub them and not know, and you can injure yourself. So it's really important that you're checking your feet, you're looking at your in between your toes, you're looking at the bottom of your foot to make sure you don't have an injury.
And oftentimes I'll have patients 2 or 3 years out come to me and mention that they now have neuropathy that with an onset that far out from cancer treatment, and they think it might be related. What would the answer be to that?
Yeah, it may be. Sometimes you have it where your nerves have been effectively damaged from the chemotherapy. Unfortunately, it's a side effect of it. As we all know, chemo, it hurts the good stuff too. And it's not necessarily the nerve itself that's dead or dying. Sometimes it's the sheath around the nerve. How your nerves work is you have a lining along them that help to transmit the message from your brain to your hand, from your hand to your brain. And that sheath is kind of like a highway for it. It helps it go faster. When you have them affected, when you have had chemo and these sheaths have been effectively either um, reduced in size, or even some of them might not have died from the chemo. A lot of times there's a permanence to it. And so 3-4 years after having a chemotherapy, or a regimen of it, you might notice that your pain, you're at a higher risk of having neuropathy, and you can certainly develop it. And that might be from having poor vasculature, whether it's from cancer or from other comorbid conditions, or having diabetes or having a pre-diabetic condition. You're at a much higher risk of developing it, unfortunately.
Absolutely. That far out, I always say, we need a thorough evaluation to make sure the causes are discovered and to make sure it's not related, just solely to the chemotherapy. It could be multifactorial, in fact.
Mm-hmm.
Um, with regards to when a patient should seek a neurologist, such as yourself, um, when would be the appropriate time to seek a referral?
Yeah. So if it's really painful and you feel like if you've tried things that aren't working, sometimes, it's a good idea to see someone who specializes in treating neuropathy, which would be us. Other times is if it's maybe something's up about it. Let's say it's in one arm or one leg. That's not normal. If you have neuropathy, it's usually in both arms or both legs or all your limbs. If it's just on one side, that needs to be looked at closer, especially if you feel like that arm or that leg isn't functioning as well as it should. That's a big problem, and that's when you really should seek out a neurologist, or at least talk to your oncologist about it too.
Well, hopefully, today's discussion can help, patients, ask the right questions for their oncologist and help them understand their symptoms and get to, a neurologist in a timely fashion. Just spark the conversation, really. So, thank you so much for taking time today and talk about this. Any closing remarks that maybe we haven't discovered in the conversation today?
I think that I appreciate all you had awesome questions. I think that if you ever have a question or you feel like there's a problem, um, whether it's neuropathy or weakness, it's always never feel bad to ask questions. I always tell all our patients, they'll say, "Oh, this is a dumb question about." Nope, it's not. It's always worth asking questions, and we're always here to help you.
Well, Patrick, thank you so much. I am so appreciative of your department. I know that my patients are too. And we'll close this up today and we'll have this online for all of our patients to see and on the Life After Cancer Patient Education Series. Thank you so much.
Yeah, thank you very much.